Pox also is caused by a virus. The disease is primarily transmitted by mosquitoes and blood lice, the reason why the infection mostly appears in the late summer and in the fall. The clinical symptoms are very typical. One can distinguish two sorts of diseases, the skin form and the internal form. The skin form is the most common. Here, warty injuries appear on the infected skin parts, around the beak, eyelids, feet, etc. When the eyelids are closed by the swelling, the birds will not eat anymore and will die. For most pigeons, however, the disease is not fatal. The injuries disappear spontaneously after about 3 weeks. Internal pox infections, also called diphtheria, are seldom established in pigeons. In this form, injuries appear in the mucous membrane of the beak, the throat, and the digestive tract. Once the pox virus has attacked, there is no effective remedy. One can, however, to avoid complications, act preventively. As such, one can disinfect the skin pox with a tincture of iodium and treat the affected eyes with an antibioticum ointment. The best solution is to inoculate annually all the youngsters when they are 6 weeks old. The inoculation can be administered simultaneously with the vaccination for paramyxo. For racing pigeons, the inoculation is carried out by the feather follicle inoculation at the foot, where a few plumes were plucked. The inoculation reaction should always be controlled. Normally the follicles are swollen after 8 to 10 days. It is presumed that most birds have built up sufficient immunity after one single inoculation. Besides vaccination, the control of insects on the loft can also play an important role in the prevention of a pox infection. Now and then, skin growths can be noticed on the pigeons. Pigeon fanciers call these small tumors bloodworts. Scientific examination have demonstrated that these bloodworts were also caused by the pox virus. This virus is not exactly the same as the pox virus, but is a very close relative. When the infection is present on the loft, the number of pigeons affected can limit itself to one or to a few. These typical swellings sometimes disappear spontaneously after a few weeks.